Well, some breaking news concerning the vaccine rollout now. We brought you the news earlier that 25 million people have now had a first dose of the vaccine. Well, the government's vaccine task force has now notified the UK Health Service of a significant reduction in supply from the manufacturers in the week commencing the 29th of March, so just under 2 weeks' time. The implications of that meaning that new guidance is being issued today to focus on cohorts 1 to 9, presumably those second doses of the vaccines for those. It comes as national booking is opened up to everyone over 50. The next period will be focusing on vaccinating those in cohorts 1 to 9 who are most vulnerable, as well as delivering to the agreed schedule significantly increased numbers of second doses, which will double from the beginning of April. So a letter from the vaccine task force has just been published. Let's bring in our deputy political editor, Sam Coates, who's had a look at it. And Sam, what does this say? Problems ahead for the rollout of the vaccine?
That's right, Sarah. The letter, which has just been leaked to Sky News, is here in my hand, and it is essentially bad news. Bad news on two fronts. First of all, it says that there's a significant constraint in supply of the vaccine coming from the week beginning March the 29th, which is an ominous sign. And secondly, the letter sets out what the NHS is going to do in order to deal with the consequences of the constrained supply. And that's bad news for people who are under 50, who haven't yet had the first jab, because the guidance from the NHS is that they're going to put on hold, effectively, people who haven't currently been invited for a vaccine, inviting them to take the jab, and instead are going to concentrate and restrict vaccinations to those who are effectively getting their second vaccine, their second jab 3 months after they got their first one. So if I just take you through some of the key language in the letter. Now, the letter comes from the Chief Commercial Officer and a representative on the vaccine programme from NHS England. So it'll be interesting to see quite how the devolved administrations respond to this in Scotland and Wales, and Northern Ireland. But it says, look, the letter says, from the start of the programme, the NHS has successfully had to adjust week to week because of light fluctuations in supply. However, the government's vaccines task force have now notified us that there will be significant reductions in supply available for manufacturers in the week beginning March the 29th, meaning volumes of the first doses will be significantly constrained. They now currently predict that this will continue for a 4-week period as a result of reductions in national inbound vaccine supply. So just pause there on the letter to make a couple of points. First of all, I interviewed the head of the vaccine task force, 3 weeks ago, and he was making clear he couldn't see any circumstances in which there would be a constraint in supply. He said the country has a lot and predicted that the whole country could have had both jabs by August, if not earlier. So he was very clear that he didn't think that there was a likelihood of a constraint in supply. This now seems to be the impact of that. Secondly, it's interesting that they're talking about a limited 4-week period in which they believe there to be a constraint on supply. Quite why that's the time frame that we have identified, whether it's because that's what they're expecting to be the decreased stocks from, for instance, AstraZeneca in the EU in case of some action to block some exports by the EU, which hasn't yet been announced, or the constraint in supply is for some other reason, we don't yet know. So the advice as a result of that reduction in supply is, whilst acknowledging that they've opened national booking today for everyone aged 50 and over, and you can see in the top left of your screen, 48% of the country has been vaccinated. They say that they're going to, what they say, maximise uptake in cohorts 1 to 9. In other words, you can see in the top left of your screen, 1.75 million people have had the second vaccine. And I think now what they're going to do is close bookings to people who are under 50. They're not going to move down those age cohorts as had been expected in the time frame that had been expected, but instead they're going to concentrate on giving people their second jabs. And here is the key couple of sentences in the letter. They say, inviting patients outside of cohorts 1 to 9 will only be permissible in exceptional circumstances. Those aged 49 or younger should not be offered vaccination unless they are eligible via a higher cohort because, for instance, they're clinically vulnerable. An unpaid carer or a frontline health and care worker. And they say to ensure prioritisation compliance and to minimise the waste that you might experience, clinicians should prioritise all stock with a limited shelf life and work with local organisations in order to identify who should be the people receiving the doses as fairly as possible. And they say that there will be more information sent out by the NHS in England shortly in order to go through this. Now, until now, the government has ridden off the back of extremely successful rollout of the vaccine programme. Anything that indicates a reduction in supply will be uncomfortable for them, particularly if people who had been expecting their jabs, for instance, people in their early 40s who'd thought that they might get jabs in, for instance, the first couple of weeks of April, will now be likely disappointed by the slowed rollout. There is, of course, a 3-month lag between people getting their first and their second jabs, longer than there is longer than the lag in some other countries. But the decision of the NHS will be to stick with that and to ensure that people who need their second jabs are prioritised rather than moving further down the age cohort. We've heard a lot today about the vaccine rollout. Not only was the government not that long ago, not many hours ago, celebrating the fact that they were opening up the vaccine rollout to those aged 50 and over, but also you were hearing this morning some of the drama around the decision to prioritise the entire vaccine programme and who should get the political spoils, as it were, for a successful rollout operation when Dominic Cummings, the former top aide to Boris Johnson, appeared before the Select Committee. And it's a mark of just how successful it has been that different bits of government have been arguing about who should get the credit for the vaccine rollout, and this will be a blip. Now, it's not yet clear how much of a blip it will end up amounting to. There are some forecasters who say that a small dip or even a moderate-sized dip in supply over the next 4 weeks or so won't dramatically alter the trajectory for most people getting at least their first jab by June and potentially even both jabs by August or September. But I think that just the news and the formal announcement being rolled out to clinicians all over the country that that there has been, in the words of the Medical Director for Primary Care and the Chief Commercial Officer for NHS England, significantly constrained supply in the coming weeks ahead will be unwelcome news for many.